All right, we're good. All right. Good morning, everybody. Welcome to the Board of Health meeting. Before we, get formally begin, we usually have a public comment period for members of the public who make comments up to about 3 minutes. So is there anybody here who would like to make a public comment at this time? Yeah, because if you want to speak, Lester, now is the time, because the hearing is closed. So when we go to the vote, we're not going to be taking testimony at that point.
Say something?
Oh, yeah.
I feel like this morning I came in and Dr. Hartman was my pediatrician for 30 years. And he told me, he said, he's so grateful, but I think I got him where he feels moved as a mom and a person who works in public health. So he was such an amazing leader for us in public health and prevention for so many years, but he was also a lifesaver to me in raising 3 children over 30 years. So if you don't mind, I appreciate that I had the opportunity to give him that tribute and thank him for all his work.
May I speak?
Yeah.
So Lester asked me to say, so I had breakfast with Lester this morning and we came in separate cars because Lester has a van, but we had a chance to review some of the things that we wanted to say. But the number one thing that Lester wanted to communicate to the board was that nicotine-free generation was one of Lester's dreams years ago. And to see it actually come to fruition, possibly in Needham, it's just the best holiday present, maybe the best life present that he could imagine. I was in Chelsea Thursday night when Chelsea voted to become the 10th town in Massachusetts to adopt nicotine-free generation. I was at the Belchertown meeting, which is the first Western Massachusetts town to vote in nicotine-free generation. That's number 11. Needham would be 12. These towns are also putting in place the nicotine pouch, not in adult-only retail stores. I think one thing that I've heard in being at all of these meetings is that the youth are all in favor of this. I have never heard a youth under the age of 21 say that they are opposed to nicotine-free generation. On the other hand, I've heard hundreds of kids speak about what they want for their future and their friends. They do not want to face what a grandparent has faced in their families, what they see in some of their friends using nicotine and becoming addicted. They just don't want that. This regulation affects them. And as pediatricians, we really trust in youth. And it's their future, and it's what they want for themselves. And we should listen to them. As adults, we need to listen to the kids because this is what they're building for themselves. Lord knows we have not left certain things at the planet in great shape for them, but this is something that is for them. And they're speaking with a clear voice about the free choice to not have a nicotine addicted generation like we have. Any high dose nicotine product is not safe. Not FDA approved, not regulated. These are the pouch situation. Once the brain is addicted, it seeks any form of nicotine, including cigarettes that's out there. If the tobacco industry wanted to promote these products as cessation aids, they have a mechanism through the government, through the FDA approved mechanism. They can put these products out there in every pharmacy and need them if they want to. They have not chosen that path. They have chosen a different path, a path of trying to addict the next generation. They do not do things that are not in their financial best interest. If they wanted to, they would never subvert their own business. They wouldn't bastardize their own business and put pouches unless it would expand their business model. That's why they have these pouches. It's just the latest example of the next product they're putting out there. 10 flavors. Zyn comes in, there's a whole bunch of copycat products now. This is Juul all over again. That's not gonna stop either. That idea of continuing to find the new product, the new higher form of nicotine. I heard from health officer that there's now a 9 milligram nicotine pouch product. That's not the end. It's whatever will get the next generation addicted. That's what's going to be for sale in the open marketplace. The intensity of vapes are increasing and the intensity of use, even though the total number of kids who are using is going down, the intensity of use is increasing. Why? Because the industry has put more concentrated nicotine in the existing vapes.
I'm just gonna have to ask you
And
to
that's
start
it.
wrapping up.
And that's it. So that is my 3 minutes. We look forward to your vote today.
Very good, thank you. Anybody else here for public comments?
Chair, there is a hand raised online from
Okay.
Stephen Helfer.
Who also gave testimony last meeting.
And there's
Okay.
Lindsay Strap as well, that's just raised there.
Okay.
Stephen, you have the floor.
Thank you for giving me another opportunity to speak to this matter. I am going to be brief because I've already spoken to you. I think it's important to realize that youth vaping, smoking, and nicotine pouch use are all at historic lows. So this is not affecting youth. It is affecting what we call adults. That is 21-year-olds and above. These are people who we deem have the judgment to decide whether to purchase alcohol, to purchase marijuana, to join the military, to enter into contracts. So this proposal really is a move in denying people their rights as adults. Again, youth are not using any of these products. I think the addictiveness of nicotine is being highly exaggerated. The CDC reports on its website that 2 out of every 3 persons who have ever started smoking in the United States have quit. Nicotine does not rob people of their free will. I'm sure everyone on the board in this room probably knows at least half a dozen to a dozen people who have quit smoking, and they have done so without any major withdrawal symptoms. It is nothing like withdrawing from alcohol or opiates. It is more like withdrawing from coffee or tea, which can produce headaches, irritability, lack of concentration, that is both caffeine and nicotine. We gave up prohibition 90 years ago. We decided that adults have the capability of deciding for themselves whether or not to drink alcohol. I think the board should refrain from youth have a choice when they become 21. They don't need to ban other persons. They don't need to ban adults from their choices. And my last comment is, I think some of the proponents of this proposal really do not have much sympathy with businesses in Needham. Most of the proponents are either academics or work for the Tobacco Control Department or in the medical profession.
Mr. Helfer, I needed to conclude.
And so I think we should have more sympathy for our business community and not hurt and devalue their businesses. Thank you.
Mr. Chair, Lindsay Stroud has her hand next, and then Elizabeth Hicks also has her hand raised.
Okay, I mean, this really should be Needham residents. I mean, that's why we have the open forum here. This is we're not giving testimony anymore. This is more supposed to be public comment. So,
Don't think Lindsay Stroud is, I don't know if Elizabeth is.
But we can't actually by law restrict in a public
Yeah,
meeting.
yeah, exactly. Okay, so who is next here?
Lindsay Stroud. It's our next person.
All right.
Hello,
Hello,
can you hear me?
we can.
You can, Lindsay.
Yeah, okay. I'll be really quick. Sorry I missed the previous hearing and I'm traveling at the moment, so I can't really use my video. So I just wanted to remind the public health community that, you know, we should be focusing on the adults who smoke. And by the way, my name is Lindsay Stroud. I'm a senior fellow at the Taxpayers Protection Alliance. We have been looking at adult smoking rates in all 50 states since 2021 with our Tobacco Vaping 101 reports. And I just wanted to go down some of these numbers. Since 2021, Massachusetts implemented the statewide flavor ban, and it just really hasn't been effective as far as reducing smoking rates among adults. For example, in Massachusetts in 2023, 9.8% of adults were smoking in 2023. This was only a 13.3% decrease from 2020 when 11.1% were smoking. And this is despite the implementation of their flavor ban. In contrast, New Hampshire experienced a 33.7% decrease in adult smoking rates between the same period, while Rhode Island saw 43.1% decline. And now among young adults, so people aged 18 to 24, in 2023, only 3.6% of 18 to 24-year-olds in Massachusetts were smoking. In New Hampshire and Rhode Island, young adult smoking rates were 3.8% and 2.3% respectively. Now, Massachusetts did see an 88.9% decline in young adult smoking rates between 2020 and 2023. New Hampshire experienced a 152.6% decrease, and Rhode Island reported a remarkable 20.4% reduction. I just want to remind, you know, smoking imposes billions of dollars on costs in the Commonwealth of Massachusetts annually. And despite policymakers' best efforts, many adults continue to struggle with quitting. Tobacco harm reduction products, such as oral nicotine products, pouches, offer these individuals a safer alternative to cigarettes. Instead of restricting access, policymakers should encourage adults who smoke to switch to these less harmful products. And thank you for your time today.
Okay, thank you. All right, next we have Elizabeth Hicks.
Yes, and there are no other hands after that.
Okay.
Fabulous. Good morning. Thank you so much for allowing us to speak. My name is Elizabeth Hicks with the Consumer Choice Center. We are an independent consumer advocacy group, and we appreciate you allowing us to be here this morning. We do have great concern with these proposals to move the sale of nicotine pouches exclusively to adult-only restricted locations, as well as a nicotine-free generation proposal, which would ban sales for everybody born after January 1st, 2004. I do want to say I think these proposals are very well
Oops, sorry.
So sorry.
Elizabeth, we'll bring you right back. Sorry about that, Elizabeth.
No worry. Bit of a mic drop, I guess. I'm just kidding. Sorry, I'll continue. These proposals will unfortunately create a bunch of unintended consequences for those residing within Needham. As some of the previous folks have said, there is no data to support a current uptake in youth use of e-cigarettes or oral nicotine pouches. According to the CDC themselves, from 2023 to 2024, current e-cig use declined amongst middle and high school students. And there also was no significant changes for nicotine pouch use amongst that demographic as well. Currently, the adult consumers within Needham can purchase nicotine pouches in a variety of stores. In addition to the federal law prohibiting anyone under the age of 21 from purchasing tobacco products, Massachusetts law also requires additional age verification at gas stations and convenience stores for anyone who may appear under the age of 30 when purchasing these types of products. This means that youth are already prohibited from purchasing any type of nicotine products at gas stations or convenience stores, and anyone who sells these products to underage youth is already facing very heavy penalties. The proposal to ban these products from these locations neglects adult consumers who are seeking a less harmful nicotine product in comparison to combustible cigarettes. Oral nicotine pouches, in addition to other reduced risk products which have been recognized by the FDA, I want to make that very clear, provide an essential alternative to the harms caused by combustible cigarette smoking. I myself am a cancer survivor. I understand the health implications that one can have from smoking cigarettes. I do not want that for the citizens of of your town, and that's why I'm here today. We need to ensure that these products maintain on the legal market to prevent folks from going to the illicit market to purchase them. I'd also echo what the last testifier said, or public commenter, about the data about the illicit market when these products are banned. One thing to also note, the illicit market does not abide by age verifications. They don't care how old you are, they're not going to check. We need to keep these products on the legal market for adult consumers, otherwise youth will have more access to them in the illicit market. So as the governing body upholding public health of Needham, respectfully encourage you to reject these proposals. Happy to answer any questions. Thank you so much for your time.
Okay, that's the only public comments we have. No one else has raised their hand.
Okay,
So we can proceed with the rest of the agenda.
rest of the agenda. All right, well, let's commence then. The minutes have been distributed. Everyone's had a chance to review those.
Yep.
Yeah,
I have a problem, just, I think it's a matter of wording, I think.
okay,
It's toward the very end of the minutes. And it was when we were talking about the tobacco-free generation policy, and then I had to leave. And I had made a motion. And then at that point, what the minutes say, upon an amended motion duly made by Dr. Cosgrove and seconded by Dr. Partridge, it was voted to pass the tobacco-free generation policy. Well, noting there needs to be cleanup in the language. Then about 2 paragraphs down, it says the board decided not to vote on the motion at this time.
Mhm.
So I think the wording just needs to be cleaned up a little bit.
Yes,
It's a little confusing to somebody who
Yes.
wasn't there.
so we can, you did make a motion. It was, I think there was more discussion.
There was discussion,
tabled.
yeah.
So I will make that amendment and clarify.
Okay.
That would
Okay.
clarify.
Good.
Does the board want to approve that with the proviso that we do the edits, or do you want to bring it back next month? Okay, next.
I mean, I'm happy doing it with the edits.
I trust you.
Yeah, everybody else okay with that? Yes, yes, okay, so we'll approve the minutes with that amendment. All right,
You need I think you need a motion.
I'm sorry.
I'll make a motion to approve the minutes with the amendment to
Okay,
the language.
second, okay. All right, I know all are in favor because we already kind of did that, but any opposed? Seeing none, we're good. All right. Okay, dumpster regulations, which we didn't get to last. All right,
Technically, this is.
this is a public hearing,
Continuation of a
public hearing, yes.
Correct. So, yep, so you have a copy in your packets, latest and greatest copy, receipt. And Tim made some additional edits and that was sent. It's in your packet, so.
1 minute, that was just the minutes.
I think,
What's that?
I think you should clarify your question. I'm not the person to answer it.
We're doing the hearing for the dumpsters, and then the next item on the agenda after the dumpsters
Will be
is not a
next-
hearing, it's
yeah.
deliberation and vote from the board.
Yeah.
on
So that's
that.
not, okay.
Yeah.
So I think the dumpsters will probably be a pretty quick topic.
We'll see.
Okay, So, right, so you have the latest edition in here. We did include a lot of the comments we had talked about, cleared up some of the finding items. Yeah, so did you have any additional comments on those proposed regulations and?
I wasn't at the last meeting when you talked about this, I think, but I'm just curious about.
We didn't
in-
talk about
Oh,
Yeah, we
didn't get to it.
it. We didn't get to it.
So I didn't miss anything. For implementation, this will apply to existing as well as new, correct? And there's a communication plan for folks about. this
Yes.
new policy.
I know we've enacted this to not take place till February, I believe here, so there is a little buffer there, February 1st. That we can have the education sent out to our existing commercial, which would be the food establishments, mainly food establishments, but this does. Give us the broader scale that we can enforce a commercial dumpster if we get a complaint, gives us more teeth to do that, so.
And by personally mean like construction. renovation,
Correct.
Which is usually not a pest harborage, but if it's a long enough construction site and there's a lot of lunches from construction
Yes.
workers that are up there, it can't be.
Yes, which we've had rarely, but occasionally we get those, so.
Have we heard anything from the various establishments who are maintaining the dumpsters?
No, so we had worked with our JP, our economic developer for the town, who has also assisted us in getting the information out to our commercial food establishments. We have not heard anything.
Okay.
We did present this also at our annual training
Mhm.
this year, so I had done that excerpt. And so we gave everyone a heads up, this was coming, let us know if you have any comments or concerns. We have not received any, so.
Did you get a comment back about the fees?
No, we haven't, but I
Okay.
think I heard Rob loud and clear that he thinks that we should do a very low fee, so we were thinking a $50 annual fee, if that seems reasonable. I know other towns are charging $100 for an annual permit, but we are thinking that this is gonna be on top of their annual food permit, they're gonna have to get a separate permit for this. So we're on the same page if you
And you
want.
would do this at the same time? you
Right.
do the-
Yeah, if it's not gonna add much time, then
Yeah.
it should be low.
$50.
It's not a separate trip.
The board could certainly send it at whatever level it wants.
Yeah.
If it does want to ease sort of the sting for businesses, you could set it at $5 or $10 level.
Sure.
Well, it's supposed to be commensurate with the amount of work that's actually put in, so that, I mean, that's. You're gonna have to tell us how, how much additional work this is.
Yeah, I mean, we do look at that dumpster area as part of the food establishment routine inspection anyway, and but I know when we do have a problem at one of the dumpsters, it can take repeat inspections time, so.
But when it's a problem, then we have, warnings and fines, so, I mean, that it should be accounting for that. But assuming that there's no issue, if you're doing this routinely already, then it really should be nominal.
I think these days $50 is.
With the board, since the board does set fees usually in April of each year, would the board want to vote potentially on the regulation and also set the fee level initially, because it will be included in this set of fees that you're gonna vote on in April, but that will be too late for us to get the permits out. So if the board want to set a fee level, could do it now.
Which I think we probably need to.
I mean, 50
Yeah.
doesn't sound very onerous, but
I mean, I think $10 is a little. It just looks like we don't really care. I think $50
Yeah.
is better.
yeah,
I don't think so. I mean, that's the price of practically a meal in some of these restaurants now. Per person.
Be lucky to get away with that cheap at some of these restaurants. All right, so I'll take that as a motion, Ed, yes,
Okay, I'll make that a motion.
all right,
Second,
any further discussion?
I support it, so.
Okay, all in favor of setting the fee level at 50?
Yes.
All right,
Okay. So there you have it, that'll be the initial fee level, and then we can revisit that in April.
and we need to vote
motion
on
for the actual policy.
regulation.
Yeah, oh yeah, we definitely need a motion for the actual thing. If we're voting on this.
Moved.
And maybe close the hearing.
Yeah,
first.
so
Oh.
first we have to close the hearing, seeing as that there's nobody who is testifying, all right? And then we can
Then
have
I'm gonna
further
move the
discussion or
policy.
vote.
Okay, I'll make a motion that we accept the regulations as written with the fee of $50. And that's it.
We have a second, and, all right, and it looks like everybody's in favor of that, so. All right, you have that, all right, that's been passed.
Great work on that.
I think it's necessary.
Yeah, well, hopefully that's gonna solve a lot of the issues we've been having. You
Yeah.
will see,
It'll give us some more teeth for sure.
definitely will have more teeth. All right, which brings us to Article 1. And its amendments. All right,
I do apologize to the board for the number of back and forths. We did get feedback from town council. We got feedback from Cheryl, a lot of helpful feedback from Cheryl Spar from the Massachusetts Health Boards.
Mhm.
And a couple rounds back and forth.
Alright. So the version that is in the packet is what we're
is
voting
the
on?
Latest and greatest, and it was the version that I also sent as a separate attachment last night.
Okay, so there is one amendment that needs to be made.
Okay.
Currently you have the restricted date of January 1st, 2005. Should be 2004.
So that certainly can be changed. That was a recommendation from Cheryl that because of the time frame for noticing the past regulation,
Mhm.
noticing the regulation which is passed and made effective, and the time to inform people of it. She suggested that we not go with 2004, that we go with 2005, which would give an implementation timeline that is quite. We could also do a different date, although I think having it on January 1 is somewhat convenient, rather than say March
It's
1st.
much, it will make it much easier if we just have a,
Yeah,
if that
full
year
year.
shows that, then we're done.
Yeah.
Because the alternative, and again, I don't know if this would work, as we had talked about this, as we do the 2004, but we don't enforce any of the, the enforcement won't happen for 90 days.
Yes, that's. another way to
Right,
do it.
because that gives adequate time, basically, if we were to run something in advance of that in terms of, a check, we would just issue a warning if that were the case. No fine, no hearing, just, hey, you should know that this is here and you should be doing this. But we would not enforce anything like that, because we do need to give the retailers adequate time.
So would the board want to potentially think about, if there's a motion eventually to approve it with the instruction for me to basically revise any date that says 2005 to be 2004? So we wouldn't have to wait until January to pass it. You would just say, we're voting on it with this change, Tim, and make the change.
Mhm.
That's what we would be voting to pass.
Right, with the idea that, and then, Tim, is 90 days reasonable in terms of, the timeline for
I
implementation?
think it is for vendor education,
Yeah,
especially because we could potentially, if the board's willing, do 90 days sort of after January 1, so.
Correct.
First, so we could start messaging next week,
right, so
but over the holidays might be a little
Yeah.
hard.
So
then we have 3
April
full
for
months.
April 1st is when it would go, when we would actually start, with real enforcement of it,
I think that's plenty of time. We do only have 6 vendors in town.
right?
That's the number of tobacco products has gone down
Right.
over time.
Now, the other thing that, has come up in the testimony has been that, tobacco pouches would be restricted somehow. Are those available everywhere now?
They're available out of 3 out of the 6 vendors that currently have a permit.
Right, but are they available anywhere else?
I mean, that's where we've seen them, we regulate those
Yeah.
vendors.
Yeah, because I mean, I hear them loud and clear. I want those to be available where they are currently, but it sounds like we're not restricting that at all.
We only, yeah, exactly.
So they're restricted to adult-only retail tobacco stores, although
Mhm.
they do not have any
Right.
adult-only retail tobacco stores.
So if they're, I think that's the confusion, right? So you just said they're restricted to adult-only tobacco stores, but we're selling them in where we sell
Currently, we're
cigarettes.
selling them in retail stores that sell cigarettes, so
Are
this
we
would
gonna
be the
continue-
change. It would restrict it if it was only adult only stores, we would have to ban those now, those 3 out of the 6.
See, I don't know that I'd want to ban that. And I think that's kind of what we had heard earlier from Jonathan, that, some of these towns have made it clear that, we're going to allow these types of things where tobacco is sold, where the controls are.
No, that's not what
No,
it's not what I
okay.
meant to say. It could have corrected so, for example, Belchertown most recently picked up this regulation, which is it can only be sold, the pouches, which are not deemed yet by the FDA as anything, consumer product or tobacco product. They can only be sold in adult retail stores. So
Yeah,
it would be a
okay.
change from what you currently have. It would be removing them from those stores.
Because
And that's separate from nicotine-free generation.
Sure,
Yeah, I think maybe we should allow them for now to be sold in the stores that are currently selling it, but don't let it expand. But again, we get,
yeah, if you have a tobacco permit, you can sell those. I mean, you can sell tobacco products, and that's included under our definition as a tobacco
So right
product.
now, they are kind of in a
Gray zone.
legal gray area,
Mhm.
because they're not regulated federally by the Food and Drug Administration. We do work with a number of cities and towns, including Cheryl from the Mass Association of Health Boards, Mark Gottlieb from the Public Health Advocacy Institute, So the recommendation from a lot of the people that do the work on tobacco control is to include the section, which is section G in the packet. So that's on page
12.
12.
Yeah. Basically saying that it's restricted to adult-only stores, so it's not in stores where it could, if there was an illegal sale, be accessed by youth. That's obviously a choice, and it's different than what is in place now, so that would have to be a decision the board wanted to make, but it is the recommendation, I think, from the advocates, including the Mass Association of Health.
Because that would be taking something away that's currently there that is less harmful than combustible tobacco.
I think it is less harmful than I guess I look at it more a little bit like Delta 8 and Delta 10, in that it's kind of an illegal gray area, and I'm saying this really shouldn't be sold in Needham. But if we're thinking about it as I don't know if it's a cessation tool, but if we're thinking about it in that context, it warrants different treatment.
I think we should allow them to continue to be sold to people to whom this tobacco-free generation law would apply anyway, but not obviously to somebody who's gonna turn 21 on January 1st of or who was born January 1st of 2005, which year we said 4. I think we should say, no, you can't buy them. Obviously, an adult who's already, who could buy cigarettes till they die. Could be able to buy these if they want them. For now, we can always change that later.
Yeah, I mean, by restricting it to adult-only locations, actually, we do have some folks, including Mark, from the Public Health Advocacy Institute at Northeastern online. We do have them not seen by youth, which, again, they shouldn't, if everyone is following the rules, they shouldn't be sold to youth. But if they're restricted to adult-only locations, youth aren't even sort of exposed.
But we don't, the problem is we don't have any adult-only tobacco stores in town, right?
We do not.
Correct.
And I think, but that is an option. Someone could choose to open. If a business decided it wanted to, it could choose to open an adult tobacco store.
Not currently. We don't have any licenses available.
True. But I don't know if one of the license holders wanted to open one, or if the license holder wanted to go to business and there was someone who was interested in opening adult-only tobacco, they could apply to take that permit.
And they could take that permit, that's true. But realistically, that's
Unlikely.
Could we say that until there is an adult-only tobacco store in Needham, these could be available at people currently permitted to sell tobacco? Or currently selling.
Well, we can certainly make whatever edits the board thinks is in the right interest of the town. I do think and I am certainly not an expert in this. I would say, I don't know how strongly folks feel about them as a cessation tool. And certainly a lot of the advocates are focused on youth access and youth smoking prevention. I do know that there's been a lot of push from advocates in the context of how the state will use the settlement money from the Jewel case to invest more in cessation resources. And I would say that realistically, it's a weakness both at the state level and local level in terms of what resources we can provide to people who are trying to quit smoking. We have offered cessation classes at the Needham Housing Authority and at the Center at the Heights.
We taught school nurses
Yeah.
in cessation.
But it is sort of we have much more emphasis on prevention than cessation. For sure.
You said the Mass Health Boards recommends this language.
It does recommend this language. All the Mass Tobacco Control Program, Mass Association of Health Boards, Mark from the Public Health Advocacy Institute, Lisa Stevens Goodnight from Mass Municipal Association. They all sort of get together and they're the advocates that work on the model reg that then cities and towns can pick and choose, or we want this section, we want that section. So it is their recommendation, but it is ultimately the board's decision what it thinks is in the best interest of the town.
May I ask a
You don't have to
clarification?
ask me, you gotta ask the chair.
Yeah.
Of Tiffany. My dad passed away. He had a patch is that a insurance cessation covered?
Yeah, patch.
The Yeah.
Patches, yes.
And you can get it for free from the state of Massachusetts with their helpline.
Yeah, no, I mean, there are FDA approved tools already. I mean, there's, you know, nicotine I mean, there's nicotine gum, there are
Yeah.
patches, they, you know, there's all of that's currently
That
available,
is true.
you know.
I'm
For
comfortable with
people,
this language.
for people who are not going to use that, though, you know, this is, the pouches are better than cigarettes. Yeah,
They
I'm not saying they're great, but they're better than cigarettes.
But there are options that are freely available. Rather they were using FDA approved things than something else.
True, but, you know, that's
Steve,
the
Leslie.
crux. We're not taking testimony anymore, guys.
I do think that it's challenging, but I do think given that there have been folks that have testified strongly against it, it's hard if we're trying to treat everyone fairly, if we recognize even our longtime friends and close collaborators to give extra comment, unfortunately.
Yeah, I mean, you have to be fair.
Tara, did
Yeah,
you?
just the only other thing I wanted to add, as you recall, Si and I did a test of the non-flavored nicotine pouches, and we've been working with Cheryl Sabara on that data, and we were told by Cheryl that these are indeed flavored. So these are something that we were gonna try to ban anyway.
Mhm.
There was the Zyn product specifically that we tested. Like, we literally tested the unflavored and it was sweet, had a sweet taste, and Cheryl, I believe, had that same data. So that was something we'd have to kind of come to down the line at some point to take those out of there, but I can't speak for the other types of products.
I mean, we could do that right now with a very simple edit, right? In section G, the sale or distribution of flavored oral nicotine pouches is restricted to
You
adult.
said these
only.
are called unflavored, but they still.
Correct. There were two types that, there was a smooth and then there was another one that we tested and
Well, we have the discretion, you know, and it's in big bold letters, right? Manufacturer's documentation, it's on page 8.
Yep.
That a product is unflavored. We can conduct a test and determine whether or not it's flavored. So, you know, that covers that. So if we just say, you know, hey, flavored, or, you know, adult only.
Yeah, I guess I would argue that the flavored prohibition already excludes those nicotine pouches.
yeah.
The question is if there are
Mhm,
truly
that's true.
unflavored nicotine pouches, should they be allowed for sale in Vita?
That's the question. You're right.
Every product out there sells light menthol in every store now. So you have some menthol flavored cigarettes, tobacco, and Zyn.
Yeah, we're,
And cotton, we're going to try to get rid of that.
you know, I'm aware of the issues with menthol.
So I also wanted to say I'm seeing like, I guess increase in, I guess, dosage of the tin themselves. So like the Zins were 3 and 6 milligrams and my last retail inspection, I saw that there was a version that was 6 and 9 milligrams and where it's gonna increase over time. Plus there's new products coming up constantly. I mean, we could regulate each one as they come along, you know. But that's what I'm seeing on the ground is that it's,
You're just saying, just ban.
I'm not saying that, I'm just saying that's what's happening.
That's what you're saying. Yeah. So therein lies the question, right? So they're currently being sold, you know, whether or not they should have ever been sold is a whole nother matter, right? So the question is, do we take those away?
Yeah, certainly our approach to regulating has kind of been to try to see when there are products that are in this gray zone. Try to look at whether there are health and safety risks, like later with the synthetic
Mhm.
cannabinoids. And then the board makes a decision based on the health data on whether this is, you know, something that should be prohibited from sale in Needham. There is sort of if we haven't said it's prohibited, it's de facto allowed. So that's where the pouches are now. We're in that kind of gray area.
Well, we could leave the language as it stands to see what happens. If we have to revisit it, we don't. In other words, just leave this as it is.
I'm comfortable with it as it is.
Yeah, I'm not terribly comfortable with that as it is. The rest of it, I'm fine. The rest of it, I'm fine with. The rest of it is really nicotine-free generation. I think it's fine.
Well, and then one question too is, should this be a separate, something separate as opposed to in the nicotine free generation piece? Right,
The same, is there a section we can make for cessation associated nicotine products?
We already, that's already, FDA approved is already in there, right? This is not FDA approved for that. Right? This is more a matter of there's something out there that might be safer than combustible tobacco. So the other thing is we don't have Rob here. He's supposed to be joining later, right? All right. May I suggest that we table this discussion until time certain when Rob joins us?
and just one other question, if we change it to flavored or we take it out, but I mean, I feel like it's a little confusing here about sorry, but we'll come back to it. If we don't say we're gonna restrict it, I think we need to be really clear about the age that it can get sold, that it's the nicotine free generation, shouldn't be getting these, just to make that
Oh,
super
that's,
clear.
I hope that is clear in the regulation.
Yeah.
Any tobacco or nicotine product
product, this
would not
includes
be
that.
eligible to be sold to.
It just got
someone
called
born
out
under-
separately, so I just wanna make sure that there's not any confusion about that.
All right. Yeah, but let's delay this until we have Rob, because it sounds like we're somewhat split on this one issue, and hopefully we might be able to get that one resolved. All right, given that, let us move on. Let's see, I think we have our last hearing, if I recall, right? Yep, Article 22, regulation of synthetic drugs.
So again, this was revised to cover only synthetic item as we discussed last time, so hopefully this is in a good place. We can move forward with that.
Does not include, as the board requested, naturally occurring kratom. It does include synthetic derivatives. Which, excuse me, we defined as, in sort of a broad way, we defined it as butcher the spelling, or pronunciation rather, but
Metragenine,
yeah, and meta,
7-hydroxymetragenine.
thank you. That's very helpful. And we did sort of include the or other combinations synthetically derived.
Right, although the way this is worded, it looks like you're banning the active ingredient. Right,
So we shouldn't have metragenine, we should just have 7-hydroxymetragenine under
I
prohibition.
think you can just stop after the end of the word kratom leads. Any synthetically manufactured derived product intended to mimic the effects of naturally occurring kratom leaves, period.
Okay. So we would change the definition there, and we would change under prohibitions. The sort of second paragraph talks about synthetic kratom.
Yep,
And we would get rid of the including but not limited to part there. So we basically strike including but not limited to in 2 places.
I think so.
Correct.
I think that doesn't take anything away from the regulation. You're just not spelling that out specifically. Any other discussion on Article 22?
I'm all set.
Hmm?
I'm fine.
All right, so do I hear a motion to approve this?
Well, I'll make the motion to approve this.
All right.
With
and
the,
Bernie
sorry,
second.
Ed,
Yeah.
you're making the motion with the edits that we just suggested about
Yes.
removing
Yes.
including but not limited to.
Yes, yes.
Great.
Okay, already seconded that. All in favor?
Aye.
Yes, okay. All right, we have it. Article 22 is passed. All right. And with that, I think we get to, no, we're not quite at reports yet, right? We have an off-street
Yeah.
drainage bond release.
Correct. So this one should be pretty straightforward. So, we did get a request from a developer to release 5 out of the 8 lots on Bell Lane, which is right off of Charles River Street. Little hidden area. I've never been down there.
I was gonna say, I haven't heard of this one.
It's beautiful area, yeah, large houses, and we, did our, the developer has to notify certified mail, return receipt requested, all the owners and abutters. We also called each owner of the 5 lots and verified that they understood what the off-street drainage, bond was and what it covered, and then we did our site visits as a final follow-up and didn't see any issues with standing water, water erosion issues, so we're in agreement that, we can go ahead and release the $3,500 per lot, which comes to be $17,500 at this time.
As long as there's no objections on the part of the property owners. And you didn't see anything wrong, I don't see any problem with this, so I would make a motion to certify this release.
Okay, any further discussion? No, okay, Tejal seconded that. All right, all in favor?
Aye.
Okay, done, released. I think that brings us to staff reports. Okay. See, we got Talib first. Is he online?
Good morning. I would like to highlight 2 key points. One is American Red Cross and MRC's signed MOA for disaster assistance work and training and exercise, which will open up more opportunities for NC8 MRC volunteers. The second key point, the state is working in connecting MA response, which is a state volunteers management system, and MRC train. And that will help with the streamline volunteer training, tracking, and the programming management. So this is the 2 key point regarding MRC. Regarding the accreditation side, we just did last reviews for our documentation. So this is from my end.
Any questions for Talib?
No.
No, all right. Tiffany, epidemiology.
Any questions? I'm not as good as Julie is on this, so I did all the data work.
Yeah, the numbers are going down. We
Yeah,
don't,
which is interesting. A little pocket we see trending down on both.
let's just hope it keeps continuing because flu is beginning to hit and I can't imagine that COVID isn't gonna be far behind. All right, nursing.
I'm over here with, Rob's Leonard, sorry.
There
I just wanted to highlight that Hannah, Johnson Stevenson fire and a sudden cardiac arrest survivor, they presented at MHOA about, the importance of preparing the communities for sudden cardiac arrest. I wasn't able to be there. I don't know, Tiffany, did you see her presentation?
Yeah, it was a very good presentation they gave, to try to help public health understand the importance of CPR and heart safe health and everything.
Otherwise, any questions for me specifically about anything happening at all? It's been pretty status quo last month, so nothing on wood right now, but nothing major has happened. No more pertussis since I don't.
Yeah, it's still tracking the TB. It's still under 5. I know
Yeah.
it's just, it's horrible the way the state provides that data now.
It really is, and unless I have to act, like do any direct observational therapy for them, they just send it through and say they're either latent or positive. And, okay. What do I do?
Yeah. Okay. Any questions in nursing?
Can I also add one thing
Yeah.
with the nursing, just so you guys
Yeah.
are aware? So we've been doing the Gifted Warmth, which is for years, I don't even know when it started,
More than 30 years.
more than 30
Yeah.
years ago, that we help residents who need to pay for utility bills. That money is quickly dwindling, and my estimate is we will be out of it by the end of this season. So Tim and I will be working to try to drum up some business with the Friends of the Board of Health, but want to make you guys aware that that may not be a program we can sustain for much longer. For example, last year we got like $120 donation, and we spent $26,000 helping people pay their bills. So our donations are not coming in.
And you've been on social media and other things trying to.
Social media was out in the newsletter yesterday. I was sending a letter to the churches, but we don't have as many churches that need them anymore.
And then CPR registrations, they get split with feedback and gift form, but when we have bills that are thousands of dollars, we're trying to pay as much as we can within reason, it's still not enough to sustain it.
I think it is one of the long-term challenges. We have very dedicated volunteers on the Friends, both of the Board of Health and Traveling Meals and on the Friends at the Center of the Heights. And they commit a lot of their time and are incredibly generous, but they are not particularly great at fundraising. So, I think one of our thoughts is, could we find other people who could also volunteer that might have some expertise, in their professional life of fundraising, or have more experience as a volunteer fundraiser to try to help jumpstart both groups.
I think that might be a good option. I can't remember where we got, how we used to do this way back when. But I know there was a fair amount of activity
So we never
around
used to,
fundraising. for
we never
this
used
at
to
the beginning.
fundraise so much as we would sort of write a letter thanking people for their previous generosity and talking about how it's helpful. And that would go to all the churches, and almost everyone would write a, $3,000 to $5,000 check.
Mm.
But there used to be 12 congregations in Needham, and I think 5 have closed or merged in the last 6 years.
That's about right.
And we also only used to do like 2,000 max a year. Now we're doing 26,000. Last year we did close to 25 or something like that.
Yeah, we've had so this year we have a deficit of $5,467 for the sum covered in the year. Last year we had a deficit of 8,000, the year before 24,000, and the year before that 14,500.
Yeah, and gas prices went up by 10%.
Yeah, well, and I think that's part of it, and I think a lot of other places are also needing donations to help maintain services as well, so it's just. What's it all going?
Does Nina Community Council get involved with this?
They do,
They're probably our most generous donor.
yes, and every year, but it's not enough to cover the whole year itself.
And they
Right.
also have, a lot of public service, social service programs, including their food pantry, that are also in more demand than they were in 2019 or 2020.
Right. It's also, whether or not to add this to the hospital MOU. In lieu of taxes.
Yes. I think we're also gonna look at some tightening. As Tiffany said, it used to be $200, to pay off the utility bill. Now it's, to get someone on a payment plan, it's
I mean,
$700 or
we see
$800.
bills up to $10,000 because people haven't paid them in a long time, or. The ones we're more concerned about are the families, but they often have bills that are $2,000 or $3,000 that we still can't pay. And
to
it's,
get on a payment plan, they need to pay down at least 25% to get off the shut off list. And sometimes that 25% is more than $700 than we kind of capped.
Mhm.
And most recently I had to tap into youth and family just to help bridge the gap for a family.
So it's a challenge. It's a challenge we've seen coming, but we haven't figured out yet how to get out of the way of it.
How long has it been since we sent out letters to the churches?
I don't think I did it last year, but I did do it the year before.
I think maybe we should try that.
Yeah.
And then there seems to be some new congregations in town. There's a new one I heard, the Avenue Church. I don't know where that is, but they ran a pancake breakfast up at the senior center one day. And did it, so we may want to get hold of.
Yeah, I was gonna tap into the interfaith clergy as well, because they would know better than me trying to figure it out.
Yeah,
And ask them to also spread the letter out to groups.
Right.
So hopefully to get some of that. The last time we did it, I got about $300 from one place. But
All right. Move on to environmental.
Sure, so, both Tara and I went to conferences, in the month of November. We're both really productive. We also had held our food safety training in November as well. And I think I mentioned that last meeting, and it was very, we got a lot of good feedback from the restaurants, and we're working on, putting together like a summary sheet around that to see how we can improve this training, moving forward. I'm working a lot November and in December right now on tying up end of the year permits. So that's been a huge task for me right now. And also we deployed 4 smart boxes and 3 different town parking lots where there were no sightings of or reports of rats being present and signs of burrows. So we put those boxes out and we're going to monitor those parking lots going forward.
I've seen a few of those. Any update on that St. Mary's Street?
Yeah, so I got in contact with one of the owners this week, and she said that her husband's still feeling still has health concerns. But she was able to remove one of the cars from the parking lot, from her backyard, and the other 3 are to come, but she's trying to force her husband to kind of take that step.
So there is some progress.
There's some progress,
Okay.
and she's hopeful it will get done by the end of this month, and I'll follow up in January.
Okay.
Okay, what's going on with Mandarin? And there's a typo as well on page 2. Ricky food safety practices. I'm not sure.
Risky.
It's
Sorry.
Risky, okay.
Yeah, so we have had a few, this was my next discussion I was gonna bring up. Basically, we've had a few establishments on watch and we had them in to meet with us, and as part of an agreement, we had them contract with us, food safety consultant. Mandarin was one of those establishments. They have since dropped their food safety consultant. We'd agreed because they were in a good place. We actually just did an inspection out there and they're maintaining, doing them much better than they were. So again, we're continuing to just basically watch them. We put them on a more increased inspection schedule. Usually that's what happens. They're on that watch list. We do bump up their inspection schedules. We currently have Farmhouse doing the same thing right now. They're working with a food safety consultant. We've been in touch with them on a daily basis, the consultant recently, just trying to make sure they're on the same page. They started their consultants work in mid-October. So again, we say that they should have a minimum of a 4 to 6 month contract with a consultant. And we get copies of reports every week to see progress. And then what we do is we bring in the owner at the end of, if they feel they're in a good place, and we review the data. And then we come to a conclusion of if they're ready to release a consultant. For New Garden, which we didn't mention on here, they were done with their 6 month contract with the consultant. Came in, met with us, asked if they could be released. Meantime, we noticed that they had a food manager there that had left. So then we said, well, we're back to square one because we're seeing the items start to slide again. So we agreed that they would maintain their consultant for another 3 months. So we have them on that 3 month extension. So these are part of the policy now. So we were able to enforce that. Right now, they're working with us on agreeing on doing that policy enforcement. So those are the ones that currently we're watching.
All right. And then the Central Ave Paint Shop.
This is auto body shop paint. So we've had some concerns with the abutters that have smelled VOC odors. And so we've actually gotten the state involved with this one. Mass DEP went out there, did an inspection. I think Si did a joint inspection. Do you wanna give them?
Yeah, so when we had a Mass DEP inspector as well as one of the assistant building commissioner also come out for a joint inspection because there were reports of they're like painting these cars and there's not a proper like ventilation system present. So there's opening up the garage doors and it kind of is floating, migrating to the neighboring property and they're inhaling these VOCs. So I witnessed it on my own and we did stop work orders for them. They're like a really small business that's been there for like for decades, and they've been operating this way for a while, so we invited inspector from the DEP. They didn't really, they're working on an order letter still to this day. I think we did the inspection back in September and they still haven't drafted an order letter, but what we had done was, we had contacted the Office of Technical Assistance. They'd done a site visit in October and, made recommendations to them to, add filters, do these different things. We haven't verified yet if that has been done. But we haven't received reports, since then. The reports we have gotten were after hours, so we've, informed the complainant to report to the fire department and they could witness if this is still ongoing and, after hours.
Mr. Chair, I just wanted to let you know that Dr. Partridge did send.
Oh, good. Okay, cool. Excellent.
We'll move back to that. I think it's important we deal with this today.
Agreed. Let's just finish up. Is there anything here with environmental health? Other questions? No, okay. All right. So Rob, you're on mute.
I read it.
Are you there?
I'm here. Can you hear me?
Yes, we can. Good. Even see you, which is kind of amazing. Are you in the Magellan Strait?
I'm right on the Antarctic Peninsula.
Ah, okay. At least on like stable ground.
So to speak.
All right, so I guess to catch you up, we're looking at Article 1. And one of the points of discussion has been the oral nicotine pouches, ZYNs and the like, which there are people who, they're currently being sold in 3 of our 6 tobacco facilities. And the question is whether or not to remove them entirely. So I think that's a fair characterization of kind of where we are.
The way the language is written, that's what.
Yeah, the way the language is written, and I think the recommendation of the Massachusetts Association of Health Boards is to remove them entirely.
Or only sell them in an adult.
Or, right, sell them in adult-only tobacco stores, and we do not have any adult-only tobacco stores in the town. So we would be taking something away. On the flip side, although many of them are labeled as non-flavored, our folks are saying that, in fact, they do have characterizing flavor. And just having them available in town means that they're more available to youth who have been using them quite a bit by report. On the flip side, it's probably safer than combustible tobacco. And so should it be available where we're selling tobacco products currently?
So you're talking about being available to people that would be over the age or not part of the tobacco-free generation.
Correct.
So I mean, I think I would be okay with non-flavored pouches still being available in our permitted stores rather than the way the regulation reads that I read last night, that it would be available in smoking bars only that we don't have.
Correct.
So I would be okay with non-flavored pouches being available in our current permitted sites.
If they don't exist, they're not going to be permitted. It's going to be that simple, right? Well,
We'll make Tara's life miserable.
Yeah.
Track.
So how you test them? I mean, I'm kind of curious how you test them.
Well,
They
we
taste-
smell
I
them.
was gonna say, put 'em in your mouth.
We smell them, we kind of, samples, but they had a distinct sweet flavor. And I was like, they're non-flavored. And Cheryl had the same data.
Yeah.
And we were saying, she's like, well, if these are flavored, and there was a town that banned them. But that would have to be the next step if we don't pass this, we'd have to go forward and have the board ban those unflavored flavored products.
I
Well,
definitely don't.
we
want these
already
patches.
are. I mean, right? Anything that's flavored, we're saying under this is banned,
And
period.
as determined by us, not by
It-
the label.
Exactly.
Right.
Real question is, if there are unflavored oral nicotine pouches, do those have a place in adult only tobacco stores, of which Needham doesn't have any, or are they in regular tobacco stores where an adult who maybe is making a better decision than combustible cigarettes would purchase them, but youth would also be exposed to them? I think that's sort of the window we're trying to figure out what the right approach is.
Yeah, I mean, is that an advertising issue? I mean, is this one of these things where they should be available under the counter? I mean, right now cigarettes are on display, right?
They're behind the gate, yeah, they're not accessible.
They're not accessible, but they're visible. And I think that what I'm hearing is that that might be the concern. So, you know, do you put them under the counter? You know, if you ask for them, they're there, but otherwise they're not there.
That could be.
I can say right now that they're like prominently displayed and they're in like a display case that's like brightly colored.
Right, but that's something that we could reasonably restrict, right?
Yeah, but if you said restricted to unflavored. Tobacco pouches could be sold in the stores that have a license. But they have to be kept out of sight. And so can be sold by request of the purchaser only. In other words, there'd be no push to sell them to people. No promotion.
I'd be okay with it.
I'm gonna just throw something out here.
Okay.
Because I think we should vote on this today.
I won't.
That's gonna take a little bit more work in terms of, you know, the advertising stuff. I mean, it'll come out of what we've done with marijuana. Yeah, yeah, it's very similar. I'm gonna propose that we take out G for today. That we pass the rest of this. We weren't talking about enforcing this anyway until April 1st, you know, with the, you know, the change in 2004. That will give you some time over the next couple of months to come up with the reg for this, and we can let our folks know that we are going to be, I mean, you know, anything that's flavored already is not legit. Right, and then we can decide whether or not we're going to, you know, just ban them outright, you know, to adult only stores, or if we're just going to restrict the, you know, the displays and all of that such that they're invisible. You know, they are available to adults, but we're going to really restrict this the same way we did with medical marijuana, you know, brown paper bags, you know, no advertising, no anything, right?
And it would, and it would have to change the date to 1/1/2004 instead of
2004, correct. Does that sound like I mean, I'm just
That's
throwing that
reasonable.
out. If
I
that's-
would agree to that.
Rob?
Yes, I would agree with that.
Yeah, all right.
You want to make-
So I will make that motion that, you know, we are going to change the date to January 1st, 2004. Up until April 1st of 2025, we will only be issuing warnings based on just on that age of the tobacco-free generation. And that we remove for the time being section G, oral nicotine pouches, and we will deal with that within the next several months once we have some regulations, which will be intended to limit the amount of advertising such to that would make them, enticing to youth. So that's the motion.
Okay, I'll second. I'm in favor.
Okay. All right, Rob, in favor of that?
Yes.
Okay. I think that's where we are today. All right. So nicotine-free generation has passed. Okay. Number 12. All right. Let's, I know you want to do a little
The
dance
vote
there.
5-0?
Huh?
Was the
Yes.
vote unanimous?
Yes.
Yes.
Okay, that's great. Thank you very much. We really appreciate that, and good luck with the rest of your work, but this will stand hopefully in perpetuity. as a lasting protection for your community and a testament to the public health leadership of Needham. Really across the country and around the world. Thank you so much.
I voted for tobacco 21.
Great. Thank you.
So when you start working on the research paper on this, I want in.
All right, great. Thank you,
for
guys.
coming.
You okay?
Bye-bye.
All right. All right, that brings us back to our reports. Sure where we are next, it's subdivisions. Is that where we are next? Thank you. It's gonna take me a while to
Yeah.
flip through everything here. Yeah, just scrolling. Page 101, okay. Oh, so I take it the compliance checks worked out fine then. Good, okay. Here we are. All right, so deadline for submission was this week, Monday.
I clicked send on late Wednesday afternoon. So our completed accreditation application is in. We still have to go through reviewing. There are opportunities to get feedback and make revisions. Thank you very much, Dr. McCoffin.
Thank you.
Yep.
And then we will have a site visit eventually. But it's nice to have that in. That was a ton of work by all of the staff and especially Allison and Lynn to get that.
Yeah. So when do we expect to hear?
I would still take about 2 months for them to review and get back, and then we have time to fix. Like
Any
6 to 8 weeks.
deficiencies? Yeah,
So, yeah, potentially a site visit in May or June.
okay. Yeah, how many other departments our size are accredited at this point?
So in Massachusetts, the State Department of Public Health is accredited with 200 employees. Boston Public Health Commission is accredited with 1,100 employees. Cambridge and Worcester, both of which are more than double our size, are accredited. And no one else.
Yeah, so we'd be the first town.
Yes.
It's a major
Yeah.
accomplishment.
Yeah.
if we do that.
Getting it
Huge
submitted,
accomplishment.
yeah.
Okay. Traveling meals.
Look like Rebecca to leave.
Okay,
She didn't have any major updates unless you had questions. I can field those. Get back to you with those.
Well, I mean, it looks like we're running pretty, within bounds of the prior years.
Yeah.
She doesn't seem to be having any problem finding volunteers or
No?
so.
I think so, anything?
sounds
It's an
like we're
extremely valuable program. We can't let anything happen to us.
good. All right, substance use prevention, part 1. Carol, who will be back shortly. So why don't we flip and do Carrie's part first?
Good morning.
Good morning.
I don't have too many updates for November. We spent a fair amount of our time for the coalition doing some planning for our winter meeting, which I can update next month, and our parent education series, which will also be another update. But I would say our 2 notable takeaways for the month were the train the trainer that we hosted for responsible beverage sales and service instructor certification. We trained 8 individuals in November in the Serve Safe Alcohol program, with the intention that we will be able to sustain this training beyond the Stop Act grant. So it was really part of the Stop Act grant itself that had this strategy as part of the action plan, with the goal towards sustaining the training for the alcohol licensees in Needham. And the other notable thing I would like to mention is that our peer recovery coach worked with the Elliott House Clubhouse, which is part of Riverside Community Care, to launch a dual recovery anonymous meeting that takes place now in person every Thursday at the Center at the Heights. It's based there, but it's open to anyone in the community who may be navigating addiction and or a mental health challenge. So we're pretty pleased to be able to offer that as a support to the community, and the attendance so far has been impressive. Good to see people coming out. So we'll probably have more on that as time follows it. I'm going to do more on the circling back about the Metro West data. You had some questions last month, and I'm going to do a little bit more of that next month, but I did note that your concern about the data point for carried weapon that was in that graph was pertaining to carried a weapon anywhere generally, and not the school property question, which was a separate one. And I can tell you that the data point that you saw in the graph for carried weapons was 2.6%. So that was in general. Carried on school property was less than 1%. It was 0.8%. And we've seen, by the way, that trend of carrying weapons in general ebb its way down into this most recent 2023 survey. Starting in 2006, that question's been on the survey, and it had a peak of 5.6% in the 2014-2016 survey. So it's been heading down since that time. But I know you have asked about that, and I just wanted to circle back on that.
Yeah, because we just need one student who brings a gun to school, and we've got a big problem. Yeah, and they don't characterize which types of weapons these are, do they?
There is a separate question about whether they have carried a gun. And that data point was much lower, but I don't think that they delve into more specifics beyond weaponry, specific weaponry.
Yeah, because I mean, the kids may think brass knuckles, kind of counts.
Right.
Yeah, which not good, but not as dangerous too. Any questions for Carol? Right, Carol, you're up.
Thank you. Our 4 towns' goals, as you know, build prevention capacity and reduce and prevent underage substance use. So what we're doing with capacity, particularly with Walpole, is trying to go to their meetings. They got the DFC grant at the end of August, and they just posted their position. So they'll have their own prevention person because they have a very limited public health staff. So I went to their community crisis intervention team on Friday and spoke to them about the behavioral health helpline and work that we're trying to do across the 4 towns to prevent access, because they're not Needham, and they don't have the people to communicate the programs, but that's going to change. Westwood will be our last town that doesn't have a grant, their own grant. And we've worked with them. They're hired a consultant using their opioid funds, and they'll be, we're working with them to restart their coalition, and they'll be applying for DFC. The deadline date was just released. It's the 3rd week of March. So for them to put that big application together, whether they get funded or not, is significant, and then they'll be able to do it next year. So the other things that we're working on is the Stanford model, marijuana curriculum, grade 8, and alcohol education. They renamed it to Safe and Smart because the gaps we identified, which are common across the Commonwealth, is there is no, although there's a mandate, there is limited implementation of health education that's evidence informed. So we're trying to talk to the health curriculum directors and see if in fact a curriculum can be administered as a science lesson or in an extended homeroom, because the time that these schools have committed to health is very limited. So it's prevention and it's capacity building. Thank you.
Okay. Questions for Carol? Okay. And the last is
Thank you.
shared public health services.
Carries on.
Hi, good morning all. So we continue to be very busy and making progress on our work for the, both the shared services and the training hub programs that Needham hosts. On the shared services side, Jen Gangadaran has taken on full responsibility for covering Maven cases for the town of Medfield. Prior to Jen being trained and ready to go, the Needham staff were providing coverage while Medfield does not have a public health nurse on staff. Jen's been able to assume that responsibility, and that's great. In addition, Amy McInerney has been working with each of the towns, and they've successfully completed a self-assessment, which is the short version, sorry, not the short version, the self version of the capacity assessment that was administered in 2022. So that gives us kind of a progress point. How have people improved? Have questions been clarified? And Amy and I are going to be working, and Sam, on sort of what's the action plan now? What are the steps that need to be taken to continue to increase the scores for all the towns? I think we're up to 85% ranking, and we need to hit 100%. As I keep telling folks, the capacity assessment scoring is the floor. That's sort of the basic minimum. And we're on our way, and grateful to the work that Amy and all the towns have been putting in to see where we are. Excuse me. And then we also identified a vendor for strategic planning. The collaborative communities will be engaging in the strategic planning process, and we have the first of many meetings. I have a little kickoff meeting next week with the vendor, which is BME Strategies. We did receive a number of applicants, a number of people bid on the proposal, or on the request for quotes, but and BME successfully came in, meeting all of the requirements and with the lowest bid. So that's shared services. On the training hub side, Sam is wrapping up her first cohort of food trainees. So that's 3 people that now I think 2 are entirely complete, and the last one Sam was going to be finishing up with early, and so she might be done already. That first 3, so that's a big accomplishment for Sam and for those trainees. She's ready for her next three cohort, and we'll be working with all of the towns in our 43 communities to try and figure out who needs help getting to be ready for Tier 3 training. Excited to have that moving. And then on the housing curriculum side, that housing curriculum for Tier 3 is in final stages of development, and looks like Sam will be ready to be doing some training out in the field with folks starting in 2025. The first 2 levels of the housing curriculum are active, and I know Jen G has been working to complete those so that she can get up to speed and be available as a housing inspector. We did identify a preferred candidate for the final staff opening that we have, which is a full-time environmental health agent trainer. I am working with HR on being able to pull together an offer for that individual. It's been a real challenge to fill this position. You may recall that, we did fill it and then it was empty, and this year this fiscal year we've posted it publicly 3 times and received, I think, about 24 candidates, and only had 3 that were possibly qualified. It's a new kind of role, and this is the challenge of filling it. And then I think lastly, I'll say that we did submit our first term financial reports and activity reports to DPH for both programs, and with Jen Casey's able assistance, it was I told him it was the first time that that this was a routine process, and that's a huge win. And thank you to Jen. So it's really nice. We have a full staffing and are able to be meeting our goals, working towards our goals. And that's all I have. Anybody have any questions?
Okay, any questions for Perry?
I have a question, but I do have to say that this has been, I've been involved in this, and this has been a really interesting experience in working with health people from health departments in the surrounding towns. And I think it's a great initiative. It came out of the statewide commission. The idea for this came out of statewide commission to sort of regionalize health while having towns still keep their autonomy. And in my experience, I think it's very valuable. I don't know what you think.
Thank you for your
This-
support, Dr. Cosgrove. We love having you on the advisory board.
And you had indicated to me that you weren't gonna be able to make the next meeting.
That's right.
Rob is the alternate, although Kathleen had previously been the alternate, her schedule lends itself to actually participating. Considering Rob is on a ship to Antarctica, would the board consider if someone else is either able to attend or appointing me as its alternate so that the meeting could take place?
Yes,
Right now, we need a quorum that requires one representative from each community.
Yeah, when's this meeting?
next
Thursday.
Thursday.
Next Thursday.
Yeah.
It's at 10 o'clock, I believe.
Tim, I'd be happy to delegate you unless,
Yeah.
if another board member can go, great, but I cannot on next Thursday morning. But happy to have you represent.
Yeah, I think the preference obviously would be to
19th.
have a Board of Health member directly. I think it would just be in this instance where the primary and the alternate both can't attend.
So I would ask that Tim be able to fill my place.
Everybody okay with that?
Otherwise, I would have loved to.
It's an issue I have with, I'm on the biosafety committee at Children's Hospital.
Right.
And that meeting has always fallen on the same day, biosafety, but I was always able to finagle it. But this time, we're having our annual public meeting, and the Boston Health Department's gonna be there. So I have to be at that meeting. So I have to miss.
Well,
it
I
this
might
time.
be available to go. I'd be a fish out of water. So I may come anyway,
That's not a problem.
you know.
That'd be a good experience. if you
Exactly,
wanted to
We'll-
just see
exactly,
it.
but having some expertise there is gonna be important.
And I will say, yes, everyone is always welcome. We love to have folks come and join us. And the meeting schedule is shifting starting in January, because of a couple of different conflicts that were identified. So hopefully we won't, we'll run into different rescheduling issues at that point, but we will be switching to Tuesday mornings, starting in 2025.
What time is it that Thursday morning?
9 a.m.,
9 AM?
Yeah.
correct.
9 AM yeah, AM. You said at night. I was gonna say, wait a minute. Okay, just so I
Can-
have it in my calendar.
Ed looked at me and said he's been involved, and I just want to say that this grant for my town has been transformative, and Carrie has done an incredible job, and Tim and Tiffany made the decision years ago to take us on through Rep Garlick's, Dover, Needham, Medfield. Our staff, just to let you know, we have one part-time office person. We have a contracted health agent who doesn't have an office in our health department. And we have one FTE, which is a full-time public health nurse who had to leave in August. So this grant, not only educationally and capacity-wise for all of us, but service provision. And you heard Carrie say the new nurse, and Ginny has been incredible to my community because she monitored Maven and did our cases above and beyond, and Tiffany for many months. So yes, since Ed talked to us about the reports and the work he did with Rep Garlick years ago, this is actually tangible in bringing lowest capacity towns to be able to provide basic services. So I thank you, and you looked at me and I understand why, because we're probably the biggest beneficiary. And it's also a motivator for us to hear Needham every month and understand that our town has to step up and start to support public health.
Well, that was my
Because-
question. Do you think this will influence additional resources
Yes.
ultimately to?
Absolutely, absolutely. And it's empowering us. And what we do with our board, we have one member, Steve Resch, who works at the Chan School of Public Health. So he's often traveling. So then we have an alternate member to get the quota. And then we have a third alternate. So Carrie's made it really great. If you ever want to join remotely, it's really a great meeting and I suggest it. She welcomes everyone. There's one vote, but everyone's welcome. And thank you.
And while I'm thinking of it, since we're mentioning, Representative Garlick, who is obviously retiring, I saw Josh Tarski recently and extended an invitation to join us here. And he is looking forward to an invitation. So whenever we can get him on the schedule, so he can kind of have a sense of what we do. Yeah, that'd be great.
I think I do need a motion if the board is gonna have me be the alternate for the upcoming. meeting.
I'll make that motion.
Okay,
Second. I'll
okay,
second it.
all in favor?
Aye.
Aye.
Rob?
Hi.
Okay, there we go.
Thank you.
Okay. All right. And that brings us to Tim. Brief notes on the finances.
Yeah, so I did want to provide the board with a brief update, or I don't know if it qualifies as brief if it's that long, but two financial updates. One going over kind of the current financial status of the public health division, including sort of what our previous year budget was, how we did on spending it, which was very, very good. We returned $348 on a $2.5 million budget. What our budget is this year and what our request is for next year. There is no sort of additional service requests from HHS. During last year's budget round, we got our positions funded permanently, so that added a part-time social worker in aging, full-time social worker in youth, and an epi and a public health nurse here in public health. So we're still chewing, I think, a little bit. We want to run with our mouth full. So the budget is mostly a maintenance budget with slight adjustments if the cost of a software program went up, or if gasoline is more expensive for the vans for the council on aging. The one sort of difference or exception is that the capital budget, there are 3 items for renovations to the center at the Heights, which were included in the town manager's 5-year capital plan. Which is not a guarantee, there's still a process to go through, but it would include money to move the fitness room into the larger game room to have more space for fitness for seniors. It would include money to have a handicap accessible rear entrance, which is where most of the handicap parking spaces are, so that just doesn't make sense in your head. And it would include money to, excuse me, design a renovated kitchen. That would be able.
We're gonna move the drain pipe.
Huh? So this is design money that would be, town meeting we would ask town meeting for in May 25. That would occur in 26, with the hope that some or all of those would get funded for construction starting in fiscal year 27. Still a long way to go, but it's nice to have them included and have that option in play.
But we need to link the the kitchen renovation to the traveling meals program as well.
Right. Agreed. I think, the capital investment is one thing, and that's no small commitment from the town. The question would be sort of, what kind of operational commitment could the town make? Could we run, as some places do, the selling the meals and paying for the food, the groceries and the ingredients as a revolving fund, so basically break even with that? If the town subsidized, a dishwasher and a cook and some of the supplies and that sort of thing. And that's a lot of the work I'm trying to do now with a consultant to try to figure out what would be the operational level investment and can we make the case for that?
Right. And then again, if the hospital's, issue with the traveling meals program was a space issue, it seems like they were saying that was the issue. we could ask them for the financial commitment. We'll provide the space, but in terms of funding that revolving fund, that could be where some of that comes from.
Absolutely. The memo also included an update on the grants. We have a number of grants, as you can see, in the public health division alone, 1.44 million this year. Recently, the town has, at my urging, started taking out fringe benefits for staff on grants and taking, in some cases, not all cases, an indirect or an overhead rate. That enables us to do some additional things. In addition to some public health things, it's also going to fund a training that the town is going to do for department managers on how to run a good meeting. So I look forward to that in the future.
Now, we'll still apply for grants that don't allow for overhead, right? Okay.
And what percent indirect are you?
Most places, most state grants to us at least only allow up to 15%. I don't think we took 15% on any last year. I think we usually took 10, or depending on if we were getting close down the end, sometimes like 8 or 7.
That's fine. It's just, Harvard's ridiculous. It's like 70%,
Yeah.
indirects.
It
It's like,
is. Oh, yeah.
Oh, yeah. Yeah, my,
Totally,
yeah, so when I write my grants and trying to explain that to funders, it's fun.
Remember when I was at the state, I managed to get BU to accept its off benefit rate, which at the time was 26% instead of 62%. And they thought I was robbing them, and I thought they were robbing me. You do see a little bit of info about our donation accounts and a little bit more about what Tiffany had mentioned about the gift of warmth in the memo. The budget is long, and I don't recommend reading it unless you're really interested. We do have a couple grants in play. We have capital budget submissions for fleet for aging services in 27 and 29 to replace their senior center vans with electric. We have a couple grant applications out that if we got those grants, we might not need the fleet budget submissions. But we do use those sometimes for public health purposes, and aging makes very good use of them. I did include in the other items, Mr. Chair, the 2 reports that I thought were interesting, tangential to public health in one sense. Tara and Cy work with our food service establishments, as does Amy and Sam, but Massachusetts so far has been the only state whose food waste ban has actually resulted in a reduction to landfill waste, which is interesting and good. You'd think it would have done it in all those places, but it hasn't. There's also a report from Change Labs, understanding the connections between children's mental health and housing. I know housing is a very popular topic of discussion in the town. Ed, last night the Council on Aging Board talked about it, I believe, about housing.
Yes.
And the Council on Aging Board actually took a public position on the January 14th vote. I think maybe unsurprisingly, they were in favor of more housing options for seniors. Because all of the research we've done for the years that we've done for seniors, we have 2 different reports that say housing and being able to stay in even as they downsize is their biggest concern.
Is there anything more? We did our letter already for that. There's nothing more that we need to do or resubmit that or anything like
The
that.
board could choose to take a public position on the January 14th election if it wanted. It is under no obligation to do so. The board is a publicly elected officials and a policy-making body. So certainly can choose to take a public opinion if you want. The professional staff are, our roles are to provide information, and we can talk about the important role that housing plays on health for sort of the entire age spectrum. But it's not appropriate for staff to say, vote nay on this or vote yes on that.
Yeah, the issue that that gave me pause at town meeting as we were talking about it is that the proposal allows building of housing by right. Now, that could get us into trouble as it did on Greendale Ave with what was then Greendale Muse, where people can just, they can build it and we don't have any say over it. Whether or not they, build it over a toxic waste dump and, where they're citing stuff is in previously industrial areas. And we would not be able to, like, this recent children's center thing, force an environmental review or what have you. So I've got some real questions about the way it's being done now. I mean, my ideal would be to, yes, have the expanded plan, but not by right. So that we would have, at least some role there to be able to say, there's a land review here, we've got concerns. Yes, you have to do this before we're going to say that this is safe for people to live here.
And I'm not an expert in this. I think there is still I might be getting it wrong. There's not a special permit process, but there's still a site plan review process, and I think Peter might know. So that does give the town some control over things.
But it goes to the planning board, it doesn't go to us. The planning board has been very ineffective in these issues, as we know.
Well, the planning board does ask for our comment on basically everything. So we could be more active in sort of asserting that.
Yes, but when they've asked for our comment in the past and we have provided it, what's happened is nothing. I mean, that's exactly what happened with this new children's center, right? They asked for our comment, we gave it, we said, you should do this, and it didn't happen. And I don't think it was their fault necessarily. I mean, that went to court, right? But again, if we say that it's by right, in the town bylaw, now someone's going to take that to court and say, hey, it's by right, you can't require us to do this.
So I think there are still some safeguards in place, but yes, the intent of the law is to cut through essentially the red tape that towns have put up around the building of housing. So it does streamline it quite a bit. So there are still some guardrails, but maybe not as many. That's for sure.
But I think if it's a health and safety issue, and especially certainly if it's covered by federal regulation and guidelines, some great guidelines, law or regulation, then they would still have to comply with that for environmental, for example.
They would, yes. And I think
so
that
I don't think it's just wide open. They just can't automatically go in and build it. I mean, that Modera on Greendale Avenue, that happened because we still hadn't complied with Chapter 40B in terms of having more than 10% affordable units.
Right.
And that put us over the 10%. Since then, we haven't seen any other developments like that.
that's
even
true.
proposed.
Although Steve was the chair at the time, and Steve and I had a negotiation, which was actually kind of fun, with the developer, who the lead now actually lives in Needham and is one of the key people behind the train noise issue. But you remember, Steve, we talked a lot about the sort of unexplored power of boards of health in terms of restricting building when it could be unsafe. We got them to move the air intakes from the highway side to the Greendale Ave side, so it was shielded by the building's mass, which was a big. Well, and we got more regular maintenance of the MERV and a higher MERV rating of the
Right, right.
which did a lot to address, not everything, but did a lot. So I do think that power is still there. But you are right, it does take away some guardrails, the by right.
Right, because in terms of like the state, again, this children's center, state couldn't move. Right, state, I think we appealed to state that this isn't our issue.
That is true.
So that's why I've got some concerns about it. So, I was almost inclined not to take a further position on it because I think that there are some, I'm a little concerned about those guardrails. We'll see what comes out. I mean, we can't change what the vote is on. But if it were to be voted down and it went back to town meeting, then I think we could, maybe say something that, hey, we still think housing is really important, but we do want to see some more guardrails. And maybe and I think that's kind of where the proponents of the no vote are. It's like, wait a minute, we're just giving everything away. They probably want a lot more than that too. But
I think that there's been a lot of misrepresentation going on. There's been a lot of both misrepresentation and misinformation coming out of the no vote people. And one of the things they're saying is that, oh, this happened at town meeting and no one was told anything about it, and this whole plan was concocted. We've talked for over 4 years, had public meetings on a regular basis. We've had all kinds of ways of trying to get out and explain what the Hone and the other groups were doing relative to the development of this plan, and then these people come out and say, well, they never knew anything about it. They're probably the same people that don't know anything, don't read the Observer or anything else. So I think that's a problem, and I think that we're putting at risk some major projects in town if we're not in compliance with the MBTA regulations. Because even if it delays the availability of funds for something like Linden Street, that project is, I don't know a lot about it, but I'm told it's very strict timelines, and things have to happen in very specific sequence that are dependent on money, some of which is coming from the state. And if that money's held up, then it just messes up the entire sequence. And that's a major project, because otherwise, if they don't do something down there, we're gonna end up condemning half of it.
So Ed, is the no vote both the base plan and the neighborhood?
Yes,
Yeah.
because of the way Michael Fee constructed the vote. We passed the
We
base
passed the
plan.
base plan,
But
right?
then the next two motions modified the base
Base
plan
plan.
to allow
So
the
it's one,
community.
right, so it's one thing.
So it's one thing.
Right, so there, you have to vote down the whole thing and then, yeah, they should split it.
I should say that, I have talked to, and, you know, the board saw the chart in the memo, about the amount of grant funding we get from the state. And so of the 1.45 million we get, 1.26 million is from the state. They indicated that nothing, in years where we have a contract already awarded would change. So that funding is secure. I don't know if, you know, if we were out of compliance for a long time, would they hesitate to renew a grant? I don't know, but it's not like on January 1st, they're going to cancel our contract for these grants. So that at least is something to note.
Yeah, I wish they had split the base and the. This no will be against all of it.
Yeah, I'm not sure what their thinking was behind what they did, but
Yeah, I mean, if that were to pass, and it had to go back to town meeting, I mean, the base was overwhelmingly, everybody was in favor of that. That's gonna be a no-brainer, whereas the neighborhood one was the only one that was kind of in contention.
Yeah, I mean, I think if you listen to at least some of the discussion, I think the question is, the base plane is only slightly bigger or more flexible than what is currently allowed, or what was allowed as of October 1st. And there have been very few sort of multifamily developments in and around sort of the commercial spine of the town. So I think the question is, is the base plan widely supported? It seemed like it got over, I don't know if it was quite unanimous, but it was overwhelmingly supported at town meeting. Would it move the needle and actually produce housing? I think, Wellesley zoned for MBTA in the area that has the 9s, right? So I don't know how many tens or $100 million it costs to build that huge building, but chances are the person who just built it isn't going to knock it all down and build a 1-story higher building, right? They just spent $100 million. So there's no way that area in Wellesley is going to be redeveloped in the next 25 years. I think there's some communities that made an effort to comply with the letter of law, and there's some communities that made an effort to comply with the spirit. And I think that is a large part of the debate right now.
Yep.
But it sounds like the board isn't interested in taking a public position in the way that the Council on Aging was.
When we submitted our stance on housing and health.
Yeah, we did. Yes, that stands.
I would like to see us make some kind of a statement, but I appreciate everybody's reluctance.
I think that's, the only other thing we have is next meeting date and time.
Yep, so we did have a doodle poll. Not everyone has had a chance to fill it out, but that helped us select a January date. And then I did want to ask if the board is interested in trying to set up a regular date and time. We can continue to schedule month by month if that's the board's preference, but it certainly would be easier both, I think, for staff and for the general public if it was, okay, it's going to be Thursday, the first Thursday night, or it's going to be the second Friday morning or something.
Yeah, what we had done, which I think was, you remember this, Ed, we had a standing time, and then I think at least twice a year, we diverted from that, because we were like early morning, and then we did a couple of evening meetings, just to allow for, some people can't make the, make those times.
It's true, although now we do also have the hybrid option, so it gives
That's
people a lot
true.
more chance to participate in public.
Mhm.
I mean, I think standing meetings are always nice for scheduling to
Mhm.
have something on the books, and I'm sure for you all, it's easier. To not have to do a doodle poll every month.
Yeah, I'd like to see us pick a specific date, like Friday morning at, like 8:30, third Friday of the month or something.
So Tim, you want to give us some possibilities, and maybe you can pop those in an email?
I'll send a separate email, so we'll still schedule January by doodle.
Right.
I'll send a separate email sort of saying, here are 5 choices, and I'll do like my own version of a doodle. Could you make generally the first Thursday at this time? Could you make the first Friday at that time?
Mhm.
Okay, great.
Right, very good.
And just so I don't get forgetful in my old age, we're gonna make edits to the minutes, specifically clarifying we
When-
talked about, there was a motion, there was more discussion, and the motion was tabled.
Right,
So we're gonna clarify that. We are going to take out section G and change the dates in Article 1 to 1/1/2004 instead of 1/1/2005.
Correct.
We do have, it's not part of the regulation, but it's the implementation that's not gonna, no fines, no tickets are gonna actually occur until after April 1st.
Right.
Yeah.
Yeah, on that specific part of the reg, right? I mean, if we have somebody, that they're selling to an 18-year-old, that's,
It has been and still isn't.
yeah,
And we're gonna take out the 2 sections in 22.4 and 22.5, I think. The definitions and the prohibitions, the including but not limited to.
Right.
Those 2 phrases will take out in their
Mhm.
entirety.
right. Right, and then we gotta work on, what we're gonna do about Zinn packaging. Which I think effectively is going to wind up banning it, because I can't imagine that they will, for the town of Needham, come up with that.
I could definitely get guides from Cheryl.
But-
Then steps forward with that.
But yeah, I mean, either under the counter or unattractive packaging, or what have you, but we need to think about all of those various options.
Put it in a brown paper bag,
Well,
staple
that's
it
what we've
together
done.
and stick it under the counter.
And I do think we can also look into what, in the form of cessation classes, what options we have at the local level to help support people who are trying to.
Yeah, I did speak with one member of the select board, and that was their primary concern. Were we removing, products that could be used for cessation for the public? And I said, I mean, look, there are lots of FDA ones that are done, that are there. But I have to say, when I was talking with them, I was aware that we were actually taking something away that was already there, that we were, that since we're already being sold in the tobacco shops. So, yeah, so, I mean, I think that's one of the concerns of the select board anyway, and I don't think it's an unreasonable one. Right. I think that concludes our business. I'll take a motion to adjourn unless somebody has other business.
So moved.
Second.
Okay, Rob, without objection?
Without objection.
Okay,
Very good.
Enjoy your trip.
Thanks, everyone. Happy holidays.
yeah.